The prostate gland is a part of the male reproductive system. It functions in the production and storage of seminal fluid and as an exocrine gland. Located within the pelvis, this gland measures 3 centimeters long, encircling the urethra, distal to the urinary bladder and anterior to the rectum. Prostate cancer, most often referred to as adenocarcinoma or glandular carcinoma, arises in the peripheral zone from semen-secreting prostate gland cells that become cancerous. The cancerous cells are initially localized, but then multiply and invade into the stroma, forming a tumor. The prostate tumor commonly invades the rectum or urinary bladder and metastases to bones and lymph nodes. With aging in men, the prostate gland enlarges. This condition is known as benign prostatic hyperplasia, or BPH, causes urinary symptoms of obstruction, which may be similar to those produced by prostate cancer. Early stages of the disease are asymptomatic. The symptoms that arise are due to the growing tumor within the gland. Urinary symptoms include frequent and painful micturition, especially during the nights, difficulty in commencing and maintaining steady urine stream, urinary incontinence and blood-stained urine. There may be retention of urine and the possibility of renal failure. Other symptoms include painful ejaculation, blood-stained semen, weight loss, pain in the abdomen, back, pelvis, and other bony areas, numbness and weakness of the lower limbs, increase in size of the prostate gland due to the tumor, which causes pressure on the rectum, causing difficulty in defecation, anemia, compression of the spinal cord, spontaneous pathological fractures, suppression of bone marrow. Age is a primary risk factor. The average age of diagnosis is 70 years. The disease is rare below the age of 40. However, the risk increases as age advances. Certain ethnic groups, such as the African American men, are at higher risk, as compared to Asian American, Hispanic and Latino men. Prostate cancer is common in North America, Australia, Northwest Europe and the Caribbean islands, and less frequent in Africa, Asia, Central and South America. The disease has a familial pattern and occurs in clusters within families. Genes implicated are the BRCA1 and BRCA2, known to cause ovarian, and breast cancers in women, and ETS genes ETV1, ETV4, and ERG increase the risk. Obesity and smoking may increase the risk. While earlier studies implicate vasectomy in younger men as a predisposing factor, more recent studies rule out a link. Vitamins and minerals contribute to the risk of prostate cancer.